folks. Here we are back again with another episode of our HSD Research Circle. So grateful to have one wonderful colleague today joining us, Doris Kakuru, and her amazing colleague from Uganda, Annah Kamusiime. And they are here today to talk to us about a project that they're undertaking together. And so I just wanted to tell you both how grateful we are that you're joining us, especially Anna, who is joining us at 6 a.m. her time. We're here at about 7 o'clock p.m. our time here in Victoria. So super grateful that you're here, and it's really nice to see you, Doris, and to meet you, Anna.
Thank you for having us.
Thanks. Unfortunately, Anna is not able to put her video on because it seems that every time she tries to put her video on, we lose her like we just did. But she's probably going to reconnect. And so we maybe we'll just, Doris, if you wanted to tell us a little bit about yourself and a little bit about the project while Anna reconnects with us.
Yes, thank you very much, Charlotte. Once again, my name is Doris, and I was born and raised in Uganda, in Western Uganda. And that's where I spent most of my life, my adult life. I left Uganda briefly to go to Europe, where I did my grad studies, my master's and PhD. And then I went back to Uganda and I worked at Kakuru University for many years. And then I moved to another university, Uganda Technology and Management University, before I moved to Canada about 3 years ago. And I've been at UVic at the School of Child and Youth Care for the past 18 months. And I'm very, very much honored to be in this at this university, and I'm delighted to be working with you, Charlotte, and to be at the HSD. I feel like this is my home. This is where I should have been all these years. Oh. So I'm very happy to be here, and I'm working on this project with my colleague, Mandip Musina, who is also an associate professor at the School of Child and Youth Care. She's a co-investigator, and I was not able to get her on this call because of family obligations at this time. And I have another co-investigator in Uganda, Grace Bantevia, who is a professor at the School of Women and Gender Studies at Kakuru University, and Annah Kamusiime, who is our collaborator, who works with a non-profit organization, Nascent Research and Development organization. She's going to introduce herself when she comes, but yeah, we are a team of 4, 2 from UVic and 2 from Uganda.
Very good.
We are working on this project, which we call Centering Marginal Voices, Building Research and Advocacy Skills for Young Mothers in Uganda. And this project investigates experiences of girls who fall pregnant in a context where adolescent pregnancy is really highly stigmatized. And we are focusing on all expectant and parenting female youth below 18 years. We refer to them in this project as young mothers. And these include girls, who have ever been pregnant, whether they lost their pregnancy or they have a child, or whether they have 2 children or 3 children. The important thing is we are focusing on the age 18 and below. So in this study, the study is really timely because Uganda's population is really dominated by young people, and 48% of Ugandans are below 15 years, actually. But the research that we do, that most people do, is led by adults.
Right.
So
Here we go.
So our study is different
Yeah,
because other studies involved young mothers as research subjects or sources of information.
Right.
You know, studies where adults question young people and record the answers and go back to their offices and interpret everything and come up with decisions and making and recommendations that affect these young people when actually they are not participating in the research themselves. And we are quite critical of this adult-centric Western ways of doing research and using research with young people, and more so in contexts where adults are actually the minority, like Uganda. So we are saying we need to pause and listen to the young mothers, know us and listen to what they have to say. What do they want us to know? And how do they want to use the knowledge that they generate? So how do they want the knowledge to be used? How do they want this knowledge to be created? And that's what we do in this research. In our study, young mothers and knowledge co-creators. We create the knowledge together. And I can tell you more about that, but maybe I should pause and let Anna first introduce herself. I can talk more faster. Pause, yes. Back to you, Charlotte.
That's great. Thank you so much, Doris, and for that introduction of yourself and the project. And
so Anna is a partner who is really in charge of community engagement.
Right.
So she works with this NGO, and the NGO is a child and youth focused NGO. So they do a lot of work with youth and children in poor urban contexts and also in regular communities. Like this study, we are working in one poor urban community and one rural community. So these are areas where the organization has been working for some years, and Anna is at the center of introducing the project to the community members and getting them involved. And yeah, that's really how work with the project is, to lead that aspect of community engagement, because it's really a community-based participatory study.
Yeah.
And she's very, very pivotal to the study. She's like a big pillar of the project, and yeah, she's very, very important.
you mentioned that she's a PhD student. Is this project part of her PhD work as well, or is that something separate?
No, that's something separate. She's doing her PhD in the more or less the same area, not this particular area, but she's working with young mothers in another community, a different community.
Right. And so how did the two of you get together to work on the project? Like, how did the group form?
So the group, as I said, I was born in Uganda and I was raised in Uganda and worked in Uganda for many years. So even before I came to UVic, I had collaboration with the Nascent Research and Development organization. And I'm still affiliated with them as a senior research associate.
Right.
So I'm still associated with affiliated with the organization. And I've done work previously with Anna. So yeah, that's how we ended up doing this together. Like we brainstormed and worked on the proposal together. And yeah, that's how she got involved. Cool. And also the other colleague from Uganda as well.
So yeah, that's very interesting. And so I'm just wondering, what kind of challenges you face in this kind of research, this kind of community engaged research with young women?
Yeah, there are a number of challenges. Of course, the first challenge is that, we this is a very highly political topic, because we are saying that we want to give voice to the voiceless. We want to empower young mothers to speak for themselves and this is something that kind of breaches the moral standards, and it's a bit of a challenge. So we have to struggle to get people to understand that, this is what must happen. Want children, young people to speak for themselves, because it's a context where, first of all, being pregnant is sort of abominable.
Wow.
Because there's this assumption that young people are asexual. They are not supposed to engage in sexual relationships.
Wow.
So when they fall pregnant, they are like outcasts. So how can you give such people even priority or a voice to speak? So that's a challenge that we have to struggle with every day. When we were trying to launch the project, we had to do lots of explanations to get audience from the powers that be. And yeah, so that's a challenge. And then, of course, there are other logistical challenges, like we are working with people who are really from low income communities. So we have to do a lot of hand holding and supporting them to even to attend a meeting. For example, we were doing meetings on Zoom, and these are people who do not have facilities to Zoom.
Right.
So that's another challenge of working. And then, of course, there are also obvious challenges like time difference. Us being here in Canada and working with people in Uganda who are 11, we have an 11-hour time difference. So,
right.
Yeah. So those are some of the challenges.
Yeah, that does. What about what have you liked best about this project, Doris? Like, what's been most rewarding for you?
Yeah, for me as a scholar activist, I'm a scholar activist who is really passionate about social justice and also is interested in decolonization of research or breaking barriers between researchers and the research through giving voice to the voiceless. I feel like this is very, very rewarding because we are in this process of decentering the adults and centering the young mothers who have been excluded and marginalized, not only in research, but also in policy and in practice. They are denied information, they are denied services. Anna was explaining the other day that they are not considered as children and neither are they considered to be adults. So they are somewhere in a lost space.
Yeah.
And for me to do this kind of work that will center their voices is very, very rewarding.
Yeah. And so what's next for the project? I mean, what are you hoping will be the outcome of the project? Do you have something in mind for the future?
Yes. So right now we are going to start empowering them to build their research skills. And then that's the next step. We are going to train them to be able to go out to the community and speak to fellow young mothers. They'll be the ones to ask the questions, collect the data, and bring it back. We sit with them and reflect on this data together, interpret it together. And this is part of the process. Then when all the data is collected and analyzed, we shall challenge them and empower them to come up with strategies. What do they want people to know?
Nice.
And they say, we want people to know A, B, C, D. Then we also empower them to say, okay, how do you want to advocate for yourselves? Right. Whatever method they use, we shall support them. They could say, we want to maybe do drama or whatever they decide. Right. We shall empower them to advocate based on the data and the findings of the study. So that's, for me, a key outcome of the study, but also we shall do a conference. We have a conference which we have called the Girlhood Conference, and it will be a national conference putting together all young mothers in Uganda. And these young mothers will be speaking about their research experiences, how they got involved in the data collection, its interpretation, its dissemination, and they'll be sharing their results with the rest of the young mothers in Uganda. So that's how that process is.
Oh, what an incredible project. This is amazing. These young women, like, I mean, what do they say about, have they talked to you at all? Or Anna, this might be something that you can answer as well when we're able to hear from you. But, what do the women, what do these young women say about being involved in a project like this?
Yeah, they are excited about it. We had one of them representing them when we had this big event to launch the project, and we invited their ambassador. We call her a young mother's ambassador, and she was speaking on behalf of the race and saying how excited she was that we are doing this, and that they hope that other countries would learn from this project itself, and give young mothers globally a voice to speak on their own behalf and to be able to do like what we are doing. So they are excited to be a part of this.
That's incredible. That is just so, what a rewarding job we have sometimes, that we're able to do this for a living and engaged in those ways with folks that, really, like, to your point, don't always have a voice in policy or programs or resource services that should be helping them, right? Yeah. Well, thank you so much. This was so lovely to talk to you, and I'm so sorry that we weren't able to engage with you tonight, Anna, but we will. We will be asking Anna to respond to some questions on a videotape that we will splice together into this. And so folks will be able to meet Anna and hear from her as well. But it was so lovely to talk to you, Doris, and it made me feel like I got to know you a little bit better.
Yeah, same here. Thank you very much for having me. Anna, thank you for coming. I hope to hear more from you.
Yeah. Hi, folks. I hope you enjoyed the interview that we did with Doris. And I wanted to introduce her colleague from Uganda. Her name is Annah Kamusiime, and she is the programs director at the Nascent Research and Development Center. And so, just wanted to introduce her and hope that you enjoy her interview as well.
My name is Annah Kamusiime, and I work with Nascent Research and Development Organization. I am also a PhD researcher with the International Institute of Social Studies of Erasmus University Rotterdam. As a PhD researcher, also my research interest is with young mothers. I am trying to explore how they are framed. But now on this project centering marginal voices, working with Nascent, I am the one who is representing my organization on this project. This project centering marginal voices is a very interesting one because by design it touches on a critical issue which for me I think has been muted for a long time: listening to the voice of the young mothers. In Uganda, when a young girl who is not married gets pregnant, society is so quick to judge them as being sexually irresponsible. They call them prostitutes. They say they are a shame to society. They are a waste, and so many other names, really, which are derogatory in nature. So generally, the blame is put on the girl who has got pregnant. So they are condemned. They are pushed to the marginal terrain in the society. They lose some of the opportunities which other girls of their age access. For example, they lose opportunity to go to school. Some of them even lose the place of abode. They may be chased from their homes. They lose their place in the girlhood fraternity, and yet also they don't fit in that of women. And rarely does society listen to the side of their story. They even do not want to know the circumstances, for example, under which these girls got pregnant. And yet we know that in Uganda, young people experience harsh realities which really shape their sexual and reproductive health. For example, there are several economic realities. There are many girls who are unable to afford even the basics like sanitary wear, like pads, like oil to smear their bodies. And so some of them may get these offers from men to support or to meet those of their needs, and they become pregnant. We also have realities like of inadequate information about sexual and reproductive health and rights. The sexuality and sexual and reproductive health is a subject which is culturally sensitive. The information which is given to young people is very, very little. A lot is hidden. And so some of them might not even know what they're entering into and how this is going to impact on their lives. In Uganda, the issue of contraceptive usage among young people is also controversial. So in one way they are allowed, in another way they are not allowed to use contraceptives. So we have these policy contradictions. So even girls don't know whether they can use contraceptives or whether they cannot. So they have no protection, therefore. So in this project, we want to pay attention to the voice of the young mothers. And that is what is interesting for me on this project. But what is even more is that the young mothers will be supported to listen to the voice of their fellow young mothers. So we are going to support them on this project as youth peer researchers. And in the end, we'll also support them to be advocates and bring out and advocate for key sexual and reproductive health concerns of their interests. Really, what is more interesting than seeing girls who have been marginalized for a long time research on issues that affect them and speak out, but also call for actions? So to me, this is unique about this project. We anticipate some challenges, I think, and for me, one of the challenges that I think we are likely to encounter is that working with young people as youth peer researchers certainly requires a lot of time in terms of mentoring them. We need to have more sessions with them. We need to reflect together on the research process. So we need time to build their capacity as researchers and as advocates. Of course, for us, this is a scientific research, and we want to maintain it as that way. We want to meet all the scientific requirements of our research, and so we need to invest in a lot of time, a lot of energy, a lot of money in mentoring them and bringing them to a level where they can be researchers, really. So I think for me, one of the challenges we are likely to encounter might be resource constraints in terms of time and also in terms of money.